The Florida Mental Health Act of 1971, commonly known as the Baker Act, allows the involuntary institutionalization and examination of an individual. The Baker Act allows for involuntary examination. It can be initiated by judges, law enforcement officials, physicians, or mental health professionals. There must be evidence that the person, possibly has a mental illness, is a harm to self, harm to others, or self-neglectful. Examinations may last up to 72 hours after a person is deemed medically stable and occur in over 100 Florida Department of Children and Families designated receiving facilities statewide. There are many possible outcomes following examination of the patient. This includes the release of the individual to the community, a petition for involuntary inpatient placement, involuntary outpatient placement, or voluntary treatment. The involuntary outpatient placement language in the Baker Act took effect as part of the Baker Act reform in 2005. The act was named for a Florida state representative from Miami, Maxine Baker, who had a strong interest in mental health issues, served as chair of a House Committee on Mental Health, and was the sponsor of the bill. The nickname of the legislation has led to the term Baker Act as a transitive verb, and Baker acted as a passive voice verb, for invoking the act to force an individual's commitment. Although the Baker Act is a statute only for the state of Florida, use of Baker acting as a verb has become prevalent as a slang term for involuntary commitment in other regions of the United States. See also 5150, Involuntary Commitment, References, Notes. Additional references, text of the Baker Act, Baker Act Reporting Center, Florida Department of Children and Families, Baker Act info, including the Baker Act, Administrative Rule 65E5, forms, FAQs etc.